Okay, so I hope you had a chance to look at our child and family poverty manual that was revamped. It contains new stats, and we're very proud of its success, and people are using it a lot. Well, for those that do not know us, with the Best Start Resource Center, we are a program of Health Nexus. We are funded by the Ministry of Children and Youth Services, and I would encourage you to visit our first page to see all the choices that you have regarding listservs, bulletin, and web watch. And the advantage is that you can get up-to-date information on best research, best practice on various subjects. Also, we have a lot of resources for professionals and also for clients. And we do consultation and training. So this is our website, and those are all the choices that you have. If you have any questions about those, please don't hesitate to contact us. These are the resource topics that we have. That's the list for the professional. Of course, they're in French and in English. And if you go to the parents, it goes by different sections. Okay, so we will start by talking about poverty to understand the issues that are facing families right now living in poverty. So we'll just go through that. And also we will talk about how to recognize that poverty as a primary social problem and a major determinant of poor health. We will also discuss how our intervention are to decrease the impacts of poverty. So children are poor because their families are poor. Just to give you a few stats, I will not go through all the statistics. I would encourage you to go to our resource to have more information, because what I've pulled for this webinar is only a very small percentage of what is available in the resource. So the most recent stats are that in 2014, the percentage of children living in poverty was 18.4, and in 89 it was 15.8. Okay, and in Ontario in 1989, 12.4 of children in Ontario were living in poverty, and in 2014 it's 18.8. So those are sadly the stats. Interesting also that I will discuss how do we define poverty. So you can think right now to your own, okay, what does it mean to be poor? How do I know if a family is poor? How do I assess them? I'll just move to this one. I'll go back. Okay, sadly, there's no official poverty line in Canada. It can be very difficult to assess and understand the prevalence of poverty because various indices are used to estimate distinct aspects of poverty, such as the lack of material goods and the finances required to live a decent life. Child poverty rates are reported differently depending on the measure of poverty being used. So I'll just name a few right now. Like I said, please go to the manual to more information. Some people use the low-income measure. Other people can use a low-income cutoff, which is referred as LICO, and others the market-based measures, which is the MBM. So all these different tools can be used to measure poverty. So UNICEF rated Canada, and it's not a good percentage. The Canada rates of relative child poverty is 14%. So it were the 25th of 35 industrialized countries. So that's pretty bad, okay? So the Canada's child poverty gap, so the depth of poverty, is 23rd out of 35 industrialized nations. Canada's tax and transfer policies are moderately effective to contrast the other affluent countries. So we're not rated very well. I would encourage you again to go and see that. And also, we another one that we talk about is the Ontario Deprivation Index that you can go and look about in the in the manual. So, all of that to say that no measure can ever capture the the depth and the experience of actually living in poverty, which, without saying, is a drain on dignity, potential, and hope. So it's every day, every second, having to have the stress of not knowing exactly how to provide for children and facing the all the impacts of poverty. So you can just understand how tremendously stressing it is to have this every day, every day, every day. Now, sometimes we can do the exercise where you hold a glass of water and go, okay, it's okay, yeah, but hold a glass of water for one day, an hour. So eventually, you will get tired. So it's not only living in poverty one day, it's the continuous effects of poverty in a long term. Also disparity. So the risk of poverty is not equal. So there are, as you know, significant disparities based on gender, region, disability status, ethno-racial identity, length of time in Canada, and many other factors. Some populations are more vulnerable to poverty, as newcomers, indigenous families, single parents, and living in certain regions of Ontario, you're more at risk. So knowing that, so if we have programs at any level that you can think of, in your program, local, municipal, provincial, federal, we go, okay, so we're going to make things better for everybody. We're going to give everybody the same equal treatment. As you can see on the first picture, that's solved the problem? No. And then, okay, so we're going to give more to one group than the other group so we can have equity. Is that what's happening right now? Do you feel that's what's happening? So, to the right, you see what so far the reality seems to be. So it's a time to reflect and to think about how do you, your organization, and your clients define poverty. Then, how do different beliefs about poverty affect what people think about families that live in poverty? In addition to being more likely to experience low income, these groups are also more likely to live in low income for long periods of time. This is troubling because the longer a person is poor, the harder it is to get out of poverty. So, as service providers, it is important to be informed about and reflect on the reason why families with young children are living in poverty. There is no single cause for family poverty. Poverty in families and young children is due to a complex mix of the individual and also because of different institutional sources. So actions to address poverty needs to be address the root causes of poverty at all different levels. Recently, I had pleasure of going to Vancouver for a conference on resiliency, and they discussed a lot about the ACE there and the adverse childhood experience. I would encourage you to look at the on that research if you're not familiar with it. And it does show the link between childhood trauma and adult outcomes. So it's very, very striking. For example, one way to measure childhood experiences is to answer a set of questions. So You can count right now because I have two slides how much at risk you are. And when we were in the big conference room, the guest speaker was reading them, and some people, as at 0, some at 4, some at 5, and then we're talking. Okay, so how did you survive? Then we'll go into resiliency, of course. But these are some of the questions. Live with a parent or guardian who got divorced or separated. Live with a parent or guardian who died, who served time in jail or prison. Live with anyone who is mentally ill or suicidal or severely depressed for more than a couple of weeks. Live with anyone who had problems with alcohol and drugs. Witness a parent, guardian, or other adult in the household behave violently towards another. Victim of violence, or you witness it in your house or in your neighborhood, and you experience economic hardship, somewhat often or very often. So the more yes you have to these questions, the more you have a chance that you will have hardship in your adulthood. So this pyramid kind of really summarize it. You had adverse childhood experience, disrupted neurodevelopment, affects social, emotional, and cognitive impairment. You're more at risk of healthy risk behaviors than disease, disability, social problem, and earlier that. So when we talk about hardship for children, one of those is food insecurity. 1 in 6 children in Canada live in a home that experiences food insecurity. Recent research in Canada has shown that the experience of hunger leaves an indelible mark on children's physical and mental health, manifesting in greater likelihood of certain condition, depression, asthma, and also that will go on into adulthood. So poverty can influence the ability to purchase healthy foods, and also it brings a lot of insecurity and negative consequences for children that will affect the way they developed. Just a fast note on food banks. As you probably know, they first were started after the Second World War as a temporary measure to help families. But now the food banks are even more in demand, and they have multiplicated to a point that there seems to be a food bank almost in every corner. So half the food bank users were families with young children under 18, and 18.1 of those families were single parents. Those are stats from 2016. So 4% of the population benefits from food bank services in Canada. And as you know, per region, per neighborhood, the quality of food banks differ a lot. And just the fact to line up in a food bank can be very demanding physically. You have to get there with children, especially if you're in a rural country. It's not easy, the transportation. And then some food banks will demand proof that you need to go to a food bank. Another hardship is housing. Affordable housing is an effective way to address high rates of poverty and to have a positive impact on families living in poverty. If children have a good quality, stable, and affordable housing, positive impacts include improving school success, community connection, and healthier neighborhoods. And we all know of the housing situations right now in Ontario. How is the situation in your area? How long are the waiting list? So, of course, in high-risk neighborhoods, there's less access to some services. Low-income families are frequently on the move, and this, of course, will disrupt children's education. And because families are on the move, they have less of a close rapport with their community. They don't have time to establish a sense of belongingness. If the province of Ontario develops a portable housing benefit for low-income households that set rental rates geared to income, thousands of Ontarians will be able to cover the cost of both rent and food, reducing the need for emergency hunger relief agencies like Food Bank. So one of the approach exactly to help families living in poverty is to give them adequate housing. And as you can see, it all leads like a domino effect. Adequate housing, then be less chances to go to the food banks. And then they would be more in their neighborhoods. They will have different have stronger bonds with their neighbors, with other families, and within the community, which are all primordial to help poverty. Health impacts of poverty are very, very startling. So poverty is not always apparent. In Ontario, 20% of families, 1.57 million people, live in poverty. Poverty accounts for 24% of person years of loss of life in Canada. So if you take a person that lives in a rich neighborhood, in a poor neighborhood, some statistics show that for a man, it's 15 years of life. That's, again, it's very high. The rates of depression for those living in poverty lines are 58% higher than the Canadian average. Health impacts again. Those in low-income groups experience higher rate of lung, oral, and cervical cancer. Those in the lowest income groups experience cardiovascular disease at a rate of 17% higher than the average Canadian. Low-income individuals are more likely to report having diabetes than a higher-earning individual. And then we talk about the highest group before. So again, if we help to counter the impacts of poverty, our healthcare system will be less burdened. We would spend less money on healthcare. If we talk about prenatal health, the early child health consequences of poverty and pregnancy are multiple and often set a newborn life on a lifelong course of disparities in health outcomes. Pregnant women living in poverty have a higher rates of preterm birth, intrauterine growth restriction, and neonatal or infant death. Born too soon or too small can result in lifelong impacts on cognitive function and health. The impact of poverty, such as excessive stress, can also affect brain development prenatally because of factors that produce maternal stress. Poverty has consistently been found to be a powerful determinant of delayed cognitive development and poor school performance. Behavior problems among young children and adolescents are strongly associated with maternal poverty. If you work in prenatal health, the stats support that investing in early years, investing in prenatal care, even preconception, will help the outcomes of mothers and definitely their children. Impacts on breastfeeding. Breastfeeding should be promoted and to support the vulnerable groups. The high cost of infant formula often requires a very significant portion of the family's income, up to 37% for low-income families. Breastfeeding increased the amount of money available to buy food for other families' members, contributing to food security. So when you go in playgroups or different community centers, you will see they give formulas to families. And as a nurse, you can go, this is not BFI, but again, the low rates of breastfeeding are lower with poor families. So do you have programs to home visits to help for breastfeeding for parents? So to encourage them to continue more to breastfeed their child. I would ask you to refer to the fact sheet on breastfeeding and socioeconomic status that's available on our website. There's different information that will be very valuable. So one of the effective strategies that's demonstrated in that fact sheet is to ask your clients, do you ever have difficulty making ends meet at the end of the month? It's been assessed that a response has a sensitivity of 98% and specificity of 64% to identify individuals living below the poverty line and can be incorporated into the assessment of a child. So to ask that question, and if the answer is yes, I'm having problems at the end of the month, bring solution. Know your area. Know what's available for them. Again, within your program, within the community, provincial, federal level, you know that there's a breastfeeding nutritional allowance per month to assist the cost of regular diet and 50 for non-dairy diet if you're lactose intolerant. But then, do you know how the family can apply for that? Do you have the forms with you? Are your doctors aware of this? So there's a lot of education to be done to help families. Do you know, do you have programs, do you have information to give them on regarding healthy nutrition, cooking on low budget? All those little tricks, again, to help buffer the weight of not having enough money to buy food, and again, healthy foods. So another thing that's not surprising, it's mental health. Poverty increases the risk of mental health illnesses. Poverty can act as a causal factor of mental health, and what leads to decreased socioeconomic status. The higher rates of infant mortality, asthma and obesity, accidents and low birth weight, again, are impacts. Again, if your child goes to school, vision, hearing, speech, and mobility. So we talked about stress. So it's the strong and frequent bombardment of toxic stress from living in substandard housing with adults who are also stressed and can set the stage for lifelong damage. Toxic stress leads to damage, weakened bodily systems, and brain architecture with lifelong repercussion. If we look at brain development in the early years, 0 to 3, you can see the pathways, the synapses that are formed. So think of how a child living toxic stress, not having his cues responding to, and seeing his parents constantly stressed, how can that affect a child? So we all heard of epigenetics, and it's something that we should be mentioning to clients and teaching them that what they do now, even if it's to them not as important, like picking up their child when they're crying, responding to cues, taking care of themselves to decrease their stress. No, brainstorm with the mother. You are stressed. What can you do? Would you like to go to a community center and talk to her that eventually this stress will affect, how their child will develop later, what the child learns every day. So by helping themselves as individual, as families, they're helping their child. Parenting is because everybody wants to be a good parent. So think of a way, an approach of just in conversation, passing that whatever they do to care for themselves and care for their children is good, because they will influence in later for their child, the way they will learn. They will influence to have a better health and also for the child behavior. These are just only a few fact sheets. I would encourage you to go and look at. They talk about epigenetics. It's from an Encyclopedia of Early Childhood Development, and it discusses about the brain development. Another place also, as you know, we have lots of information on child development. You can go on our tip sheets, A Healthy Brain. So you can talk to parent about very specific age, about brain development, activities to do. So other impacts are on education. You all know of the EDI. The community profiles are available for most regions in Ontario. So to find your regional profile, you search on the web for early development instrument and the name of your community. So one of the EDI strengths is the integration of child development outcomes with other source of data about children, families, and communities. Poverty has consistently been found to be a powerful determinant of delayed cognitive development and poor school performance. Behavior problems among young children and adolescents are strongly associated with maternal poverty. So poverty, in the long run, influences language development, and by 18 months there may be significant differences in both vocabulary learning and language processing efficiently. By age 2, children in a lower socioeconomic group are beyond their peers in measure of cognitive, language, social, emotional. A 6-month gap in language skill undermines learning a lot. So here is the information on healthy brains, healthy babies I was mentioning to you, which can be shown to parents. You can give them their fact sheets. So talking about children's feeling. So a sense of self unique to each child and is influenced by how the child is resilient or not. So resilient is promoted through experience such as positive relations and experience with family, community, and school, which may be limited for children living in poverty, as we mentioned, because some of them maybe have housing, they don't have the services, also because they travel a lot to different parts of Ontario and not stable in housing. This is a resource that I would encourage you to view. It talks how to help parents promote their own resiliency so they can affect the children's resiliency, what it means. We also have a ready-to-use workshop for you, the service providers, to do a workshop for families. I don't know if you know of this doctor, Michael Unger. Again, being in Vancouver, I had the chance to hear him speak. He wrote several books, and when we heard about ACE, he says, okay, so we have these people with very adverse childhood outcomes. So how come, some people with ACE scores of 4, 5, 6 are thriving now, are adults functioning in life? What did they do? So, we all have different ways of helping families with parenting, community, referring them to the community. He developed 9 points structure. Consequences, parent-child connection, lots and lots of strong relationship, a powerful identity, a sense of control, a sense of belonging, fair and just treatment, and physical and psychological safety. So if we look at our housing, and it goes again in strong relationship, because we know that people can move more, and if they don't have a stable housing, a powerful identity. So they're all interconnected. But when we do home visits, when we have people in our group, in our community center, we do programs to help people living the impacts of poverty. No? We have to look at how to make them more resilient, to be able to buffer all the impacts of poverty. And this is a way of looking at it. As I mentioned, you have to work with the individual. So we have to work with the child, the parents. So if the parent develops more thinking skill, more confidence, that will affect the child. The child, as you know, the child models. They look at their parents and they learn from their parents. So working on the individual. And you, if you're in a daycare, in a play group, and you see children every day, even if it's only an hour, if you show them, good thinking skill, you're confident, positive outlook, you say hi, even if you go in a home for 5 minutes, you're positive. Of course, this reflects on the parents or the family you're visiting, and the child sees that. So it's all things that we as service providers need also to work on our inner strength to be an excellent role models for those families, those children, and the community. And then we have to look outside of the circle. Where are those families or children having their positive role models for? Can they go to their community resources? Are the resources again positive? Are there other caring adults? Are there caring relationship? The grandparents, the neighbor, you as a professional, other outside support. So it's not only looking at the individual or the community. It's all again in a big mix. They all work together. If somebody is left out, now they have this lack of inclusion. They can experience in many negative way. Again, will affect health. There is a direct negative impact on children's health as well as their sense of belonging. Poverty limits active participation in the community. It means limited opportunities for children to play sports, pursue music, drama, or cultural activity. CAS, children from lower income neighborhoods are more likely to be removed from their homes. And core housing needs are not met, there is a higher risk of admission to child protection services. Lack of adequate houses is a factor of 20% of children protection cases in which children were taken into temporary care in 2000. Families, some parents are afraid of CAS. They feel because they're poor, they have to show that they are better parents, They always have this strain, will somebody come and take my child away from me? So how to address this stress with parents? Are you able to have an open conversation about this subject with the parents? A lot of children come into care because of poverty. Families don't have the resources to provide the basic necessities for their children: food, clothing, and housing. Certainly, the love the parents have for their children isn't diminished, but poverty is a key factor. Addressing this with parents, addressing how parents talk to their children about poverty. How do they explain it? Many of the families lack a supportive network and that they can count on. Families in poverty tend to have tenuous community and social networks due to regular address change. Lots amount of energy is just taken to survive, so they're very in stress. Being stressed like that, ongoing, there is a sense of isolation. It's also then will affect parenting. Then they will have less social networks and less positive interaction with their children. A big vicious circle. Interesting. Poverty and poor mental health decreases the quality of the parental interaction. The Canadian Council on Social Development found that positive parenting styles were the same regardless of level of income. The quality of parenting behaviors was mediated by factors such as good mental health and larger community networks. Again, the push to offer support to these families living in poverty, connecting them to their community, connecting them to other families, to agencies, to all types of healthcare, schools, and working on for them to have a good mental health, making them feel worthwhile as good parents. So the constant mental strain of being preoccupied with money affects parents on different levels, leading to family distress and causing difficulty in relationship. How do we address these concerns with parents? What type of resources do we have? Can we assist them? And how do you do it? Because adversity piles up. And when it does, you're less able to deploy all the skills that you may have to face challenging circumstances. It's like balls being thrown at you. You can catch them. You can catch 1, 2, 3, 4 balls, But then imagine 10 balls coming at you all the time. After a while, we just kind of bend down on the ground maybe and go, okay, go on, keep hitting me, So just imagine that. Poverty stress interferes with our ability to make good decisions. Short-term needs are so great and the long-term gains seem so impossible. People living in poverty make decisions that seem like the most rational response to a world of chaos and unpredictable outcomes. So research by Manny et al. Shown that being preoccupied with survival creates a cognitive deficit equivalent to a loss of 13 IQ points, losing entire night's sleep, or being a chronic alcoholic. So the preoccupation takes up so much of your mental bandwidth that you have less in terms of cognitive capacity to deal with things that may not be as urgent as you think they are, but which nevertheless important for the benefits of the medium and long term. So you can see a family and you look at them, you go, can't you see this is important, this is an emergency? And they might look at you going, yeah, okay, I'll get to it. They don't see to have the sense of emergency to move. For them, it could be that, again, being so preoccupied. Was it a shutdown? Are they depressed? What's happening? So this, like I mentioned, early childhood, severe frequent stress redirects children's brain development away from planning and impulse control towards building the capacity for rapid threat response. So therefore, in adulthood, excessive stress overloads adult ability to use executive function and intentionally self-regulation skills, leaving them to rely primarily on an automatic response. I'm sure if we were in a workshop right now, we could talk about families that you visit and that you dealt with. Some that you will never forget, that you remember. I'm just going to read a little story to you. Why I make terrible decisions. I make a lot of poor financial decisions. None of them matter in the long run. I will never not be poor. So what does it matter if I don't pay this week instead of next week? It's not like the sacrifice I make will improve my circumstances. So what if I blow $5 at McDonald's? I have proven that I am poor, and that's all I am, or will ever be. It's not worth it to me to live a bleak life devoid of small pleasures so that one day I can make a large single purchase. I will never have large pleasures to hold on to. There's a certain pull to live what bits of life you can while you have money in your pocket. Because no matter how responsible you are, you always wake up and broke in 3 days. When you have never enough money, it ceases to have meaning. I imagine having a lot of it is the same thing. Poverty is bleak and cuts off your long-term brain. It's why you see people with 4 different baby daddies instead of one. You grab a bit of connection whenever you can to survive. You have no idea how strong the pull to feel worthwhile is. It's more basic than food. You go to these people who make you feel lovely for an hour at a time, and that's all you get. You're probably not compatible with them for any long term, but right now, this minute, they can make you feel powerful and valuable. It does not matter what happens in a month. Whatever happens in a month is probably going to be as indifferent as whatever happens today or last week. None of it matters. I don't plan long term because if I do, I would just get my heart broken. It's best not to hope. You just take what you get as you spot it. Check your perception on those living in poverty. Because we can have negative perception, belief that poverty results from personal failings. This presents an impediment to health and social services provided and policymakers seeking to tackle the poverty. Social contact with negatively regarding groups can help to combat these views and improve attitudes and relationships. Negative perception affect how people see themselves. These experiencing poverty show significantly lower level of confidence in their own ability to succeed. This has negative physical and psychological health consequences, along with reduced educational and professional attainment. So how do you react? You're nonverbal, you're verbal. How does your family think about poverty? Do they know what it means to be poor? Do they know about chronic stress? You can feel bombarded and unable to think and going hungry. What do you think at work? What do you think your community thinks? We know of example. I know of example where I had to make phone calls sometimes to different agencies to get the service that the client deserved. We all hate the way we're put on hold, and then we don't get to talk to that person. So imagine having that every day when you call for help and assistance. Oh, it's her again, or it's them again. Oh, really? So, how many families do you know that's happening to? Yes, I can provide my story. Yeah, it is powerful. Every time I read it, I go, oof. So, a population health approach. As I was talking, we need to understand the why. So, what do we see? We see an individual that's poor, and then eventually they can have chronic disease. So, what's the root causes? As discussed, adverse childhood experiences and toxic stress. What do we do to address those root causes? Do people understand what a childhood negative experience is and toxic stress? Because a lot of people, what they see is the symptom. Mothers like to line up for food banks, and then all the negative comments that can go Oh no, how many children do they have? And you all know. And then to make a decision based on evidence. So example of evidence-based practices, you make positive connections. For example, to parenting supports, home visiting, breastfeeding support, community kitchen, and then the child tax benefits. Do they know of it? Do they know all of the means to have the money that they are entitled to? I had the pleasure also to listen to the first pediatric center that was open in Ontario. It's in Vanier, and so it's very like a social pediatric center based on the one from Dr. Julien in Quebec, and they have a multidisciplinary team seeing families and working for them. So, for example, if Mary has a lot of asthma, why does Mary have asthma? Mary has asthma because she lives in a household with mold. Why is the family living with mold? Because they can, you can see. Ask the 6 whys, the 7 whys, and you go down to the root of the problem. All of that to say, the social worker was telling us that she has the luxury to take time. At one point, she had 3 times she had a cup of coffee with a parent before starting to talk about adverse childhood experience and what the problem is and bring solution, because the rapport needed to be established. You need a connection. We talked about that. About resiliency. People will have difficulty open up. They're tired of telling their stories to different people all the time. So when we have evidence-based practices, it's something that people, first of all, they need to be willing to go. They need to feel a bond. They need to be in one place long enough to go there. So all of these factors need to be addressed. A lot of sub-factors to think of. So you know about the community kitchen, the food vouchers, subsidized daycare. Are they available within your area, within your program? Do parents know of it? How can you bring them there? Can other parent help? All the strategies that you can think of to help. Population health calls for to be innovative and interconnected strategy to give, the consideration to a full spectrum of social, economic, and environmental health determinants. So it's working together, it's breaking the silos, and opening the doors to those families and those children. So listening to parents. When you're dealing with survival, you have to put food on the table, roof on their heads, and again, basic chronic stress and trying to meet the kids' need. So when the book on poverty was developed, there was lots of consultation done within Ontario, and these are only a few of the comments that parents living in poverty told of what they were looking for in a service provider, to have a broad understanding of the issues facing families, to focus intervention on decreasing the impacts, like I was talking about. So what can you do? Childcare, health, housing. We talk a lot about housing and the importance of it. And if housing will affect health, will affect childcare, will affect food, and all of those. Unemployment. Again, if you're unemployed, you're on social support, it could affect child development, food, access to food, childcare. What do we do? How can you support parents struggling with multiple stressors? Buffer against the effects of poverty. Sensitive and responsive caregiving from a parent or a child care provider can serve as a powerful buffer against stress hormones exposure, even if children who might otherwise be highly vulnerable to stress system activation. When I was talking about epigenetics, mentioning to parents that what they're doing right now, picking up their child, responding to their needs, responding to their own need as parents will help to decrease stress and will help in the short term and, of course, in the long term. Assuring that a young child has a reliable, safe, and engaging relationship both at home and outside of the home care can buffer those effects of multiple stressors that exist in his or her life. So 69% of parents say that they knew more positive parenting strategies could help them. So 69% of parents are open to hear what we have to say about parenting. As you know, we have resources for parents, and I was mentioning there were per different sections. So you can, if somebody has a baby or young children, parents can go to our website and learn about parenting, brain development. You can bring those resources to them. They're free, and they're French and in English and some multicultural. You have your own parenting resources. Important to talk. So we're talking about buffering relationship for the child, for the parents. The strength of having peer-to-peer support, having a welcoming community, knowing your rights, what you are entitled to financially, and having help to access those also. So there are 3 things you can do that can have an impact on a child's health. It could be a simple reminder, helping to fill forms, provincial, educational, housing, supporting them to enroll in a program. Decrease the stress of having to look at a form and all you see for those parents is black on white. They're unable to read, not because they're illiterate, it's stress. So ask questions in a very safe and sensitive way. Ensure that all the staff, you are available, resources available to the parents and families. Then intervene. You connect them to the resources and their services. Typical question. You ever have difficulty making ends meet at the end of the month? Do you receive the child tag benefit on the 20th of every month? Have you filled out and sent in your tax form? Do you have with you a tax form? Do you aware where people can go in their community to have help to fill it out? Again, it can be because of their stress. They've never done it before, and for X reason and Y. Assist them to fill in their tax forms. There's a website for parents. In our resource, at the end of it, there's resources for service providers, and there's also a page on resource for parents. You can photocopy it, bring it to the parent. If you have a laptop or an iPad when you go and see parents, or if they have one, you can open it together and help them do the forms. If not, direct them to somebody that can help them. So, for example, one way to intervene, like I said, you have those blank forms available. Maybe for the breastfeeding and nutritional benefits of, maybe to help parents fill in a form for other things. It could be for daycare. It could be for sending their child on a school trip to apply because they have no money, so it can be subsidized. Provide a warm transfer and connect parents to services. Here is Service Canada or any type of services. Partner with another agency to offer a free tax clinic, any type. of clinic, any type of gathering for parents. Provide tip of the day to the parents, and next meeting, brainstorm other ideas how you can intervene to buffer again the impacts of poverty. So you want to prevent deepening psychological concerns. You want to help them not feel so helpless. Be knowledgeable about how to reduce access to basic food, to shelter, healthcare, mental health services. Special attention to the needs of children during periods of severe hardship or being homeless. Reduce barriers by accessing basic supports such as nutrition, food, safe shelters, healthcare, mental health services. So all of these now that you have, you can intervene and inform parents. Help parents to strengthen the skills they need to create a stable and supportive home environment with consistent and predictable routine. I'll say it again, consistent and predictable routine. You may have to explain why it's so important. Two parents have the same approach toward the children, same type of discipline. Why is it so important for children? And for example, sleep. Even adults, we need a routine. How many of you have a sleep routine? So much also teaching to be done about screen time. Screen time doesn't help. If you see a child, in a family always in front of the TV, you can ask, is this a good time? Can we talk about it? It wouldn't be a good time if the mother is looking to put food on the table. So this will not be a good approach. Work with the families to see where they're at and how you can help them having more constant and predictable routine. Maybe for them right now, it will be to access safe food. So ask often and respond to major stressors affecting families as part of their assessment process that you conduct in many types of service programs. So when you greet somebody, you go, hi, how are you? Can you change it to, hello, Julie, were you able to sleep last night? Hey, did you go to that food bank we mentioned? How's little Johnny? Is his asthma better? No, very more specific questions to ask. It's the end of the month. Are you okay? And enough food to put on the table? I'm being afraid to ask. Provide services in well-regulated, welcoming environments. Provide staff in services programs to support the needs and reasonable caseload, size, responsive supervision, and skill development to manage their own stress so they can help their clients effectively. Now we talk about resiliency, that families will look at you also how resilient you are, positive, how you deal with issues that comes forward, and they learn from you. If you go into a house or in a program and you're stressed and not short-tempered, not coping well, time for you to take a break. And we, as you know, probably we have a resorts on burnout, on professional stress that would advise you to go in and look at. And you have a buffer system of your own at work to go in and talk to about your caseload. The well-being of children is a shared responsibility in Canadian society. While parents play the primary role in nurturing and caring of their children, we recognize that families operate within the context of communities, workplace, and public institutions. The role of governments is to ensure that each of these setting functions individually and together in ways that support families with children and children with families. Just going to talk about a very few initiatives that were taken, and please refer to the new updated resource. In 2016, the federal initiative included the universal child benefits, and then affordable childcare. They invested 7.5 million. In Ontario, there was the Ontario Early Years Learning and Childcare Agreement. In 2017, the renewed Early Years and Childcare Policy Framework and Inspection Plan, all in our resource. So Ontario initiative are to remove barriers to building housing to increase access to rental and affordable housing, making enhancements to the province social assistance by increasing rates, providing extra support for people in remote and northern communities. So for U.S. service providers, keeping abreast of new developments happening at the provincial and federal level. So in our ideal world, make poverty a priority, commit to working collaboratively, develop the skills needed to facilitate collaboration, create strong, durable relationship between sectors, that's health, education, transport, environment, finance, housing, involve communities and parents living in poverty to develop policies, programs, and services. Implement in its entirely for the United Nations Convention of the Rights of the Child in Canada. If you look at it, we are not meeting all the requirements. If we do meet the Convention of the Rights of the Child in Canada, this would improve the lives of many children and families and would assist in eradicating child poverty. When was the last time you opened that document? It's a very interesting read. Maintain universal health care. Remove the 3-month wait period for new immigrants. Increase access to programs such as mental health, addiction counseling, dental services. Offer health benefits for the working poor. Every time I have a workshop on poverty, always the question, working poor, you have families that are on Ontario Works. They start working and they're poorer of when they were on Ontario Works. So to offer the benefits so there's not a gap from moving forward into the working world, ideally. Guarantee income for families with children. Provide support for families moving from Ontario work to the labor market, as discussed. Recognize qualification and credential of new immigrants. Provide access to quality education and training. Provide affordable, accessible, high-quality early childhood education and care services. We're talking about brain development. So imagine that for every dollar we spend on the childhood education, taking care of prenatally, early also when a child is newborn. That $1 in the long run would be $7. And the new statistics I was reading, it's up to $9 that we would save. Mandate education requirements for service providers, such as understanding the determinants of health, community resources, and the impacts of poverty. Built and sustained services and support for children and families. Collaborative, equitable, inclusive leadership is about recognizing the different levels of power and resources that different people and organizations hold within our partnerships. It's about developing strategies and changing practices to address imbalances. It's a commitment to ongoing dialogue, reflection, and action to make sure that equity-seeking, marginalized individuals and groups are at the center of our collaborative leadership and decision-making. Imagine. I love again this picture where everybody would be equal. They would don't need to have always a little buffer system. Everybody could see the game with no barriers. I look at that picture and I go, wouldn't that be nice? They may forget what you said, but they will never forget how you make them feel. Talking about you when you interfere, when you meet parents, when you meet children, when you're in your community. So take the time to reflect and discuss. I name a lot of different things that we can do to buffer. Is one of them for you and in your organization to understand what poverty can cause on health, mental health, and what does it mean to live in chronic stress all the time? Look at what you can do in your practice to support services and policies. How you can make your clients aware of benefits and how you help families access them. How can you, your organization, listen to the voices of children and parents to learn more about what they see and live in order to improve their well-being? Have a sense of humor. When nothing goes right, go left. I don't know what to do. Okay, I'm always going right. Okay, go left. Develop your own answers, your own approaches to with families. Use tools. This is the one that was developed by for the primary care providers, and the link is there. Question that family doctors have that they can ask. Making ends meet, trouble feeding your family, trouble paying for medication. Children medication as are paid for. What about if the mother has a severe asthma and her Ventolin or cortisone is not paid for? How can she have them to pay for it? Do you have legal or immigration challenges? Do you have a safe and clean place to live? This is taken from our resource about nutrition resources. Like I mentioned, go to our resource to have more information on resources. Other financial resources, like there's one that explains the kind of benefits on videos, Ontario Electrical Support Program, social assistance in Ontario. Okay. Do we have any questions? Okay, so I see here for about the story. Yes, I can, Teresa, send you the script that I read, why I make terrible decisions. Hopefully, I pique your curiosity. You will open the resource that I mentioned so much about, and other resources that we have, and also resources that you have right beside you that you can maybe adapt or show as is to parents. Sit with them and look at them. If we talk to a family about budgeting, are they there? Are they ready to listen? Or do you know anybody can go shopping with them and show them? Go through the aisles with them. Go around the grocery store instead of going in the middle of all the chip and fast access food are. So it's looking to help families, listening to them and buffer the impacts. If you have any questions, I encourage you to email me. And also, I would like to make you aware that our resource, Child and Family Poverty in Ontario, is being translated in French. So we could be useful if you do French training, or maybe to put in your orientation manual for new staff to revise if you're more French speaking than English. And I send you the link. I will send you the link again for the evaluation. I would really like if you could take 2 minutes to complete the evaluation about this webinar.